Here is some detailed information about the use of bottles and pacifiers in babies. Bottles. 1. Bottles are a common way for babies to receive formula or breast milk when they are not being fed directly from the breast. 2. It is recommended that babies be fed on demand, rather than on a strict schedule. 2. This means that babies should be fed when they show signs of hunger, such as rooting or sucking on their hands. 3. It is important to hold the bottle at a slight angle so that the milk flows slowly into the baby's mouth. 3. This can help prevent the baby from swallowing too much air, which can cause discomfort and gas. 4. It is also important to burp the baby after feedings to help release any swallowed air. 5. As babies grow and become more efficient at feeding, they may be able to hold the bottle themselves. 5. However, it is still important to supervise feedings to ensure that the baby is swallowing safely and not choking. 6. It is generally recommended to transition babies to cup feeding by around 6 months of age. 6. This can help prevent the development of a bottle feeding preference, which can make it more difficult for the baby to transition to solid foods. Pacifiers. 1. Pacifiers can be a useful tool to help calm and soothe babies, especially when they are going through a period of intense crying or when they are trying to fall asleep. 2. Pacifiers can also help reduce the risk of sudden infant death syndrome, SIDS, by helping babies maintain a normal breathing pattern. 3. If a pacifier is used, it is important to make sure that it is clean and in good condition. 3. Pacifiers should be replaced regularly, as they can become worn or torn over time. 4. It is generally recommended to wait until the baby is around 4 to 6 weeks old before introducing a pacifier, as this can help establish breastfeeding and prevent the baby from developing a preference for the pacifier over the breast. 5. It is also important to avoid forcing the baby to take a pacifier if they do not want it. 5. If the baby refuses the pacifier, it is important to respect their preference and try again later. 6. As babies grow and become more interested in exploring their environment, they may begin to reject the pacifier on their own. 6. This is generally a normal part of development and does not require any intervention. Here is some more detailed information about bottles and pacifiers. Bottles. 1. When preparing a bottle of formula or breast milk, it is important to follow the instructions on the formula packaging or the guidance of a healthcare provider. 1. This can help ensure that the baby is getting the right amount of nutrition and that the formula is mixed correctly. 2. It is generally recommended to use a bottle that has a slow flow nipple, as this can help prevent the baby from swallowing too much milk too quickly. 2. The size of the nipple should be appropriate for the age and stage of development of the baby. 3. It is also important to clean and sterilize bottles, nipples, and other feeding equipment before each use. 3. This can help reduce the risk of infection and contamination. 3. Bottles can be sterilized by boiling them for at least 5 minutes, or by using a microwave or electric sterilizer. 4. If the baby is being fed breast milk, it is important to store the milk properly to ensure that it stays fresh and safe for the baby to drink. 4. Breast milk can be stored in the refrigerator for up to 5 days or in the freezer for up to 6 months. 4. When thawing frozen breast milk, it is important to do so slowly in the refrigerator or by using a cold water bath. 4. Heating breast milk in the microwave or on the stove can destroy important nutrients and enzymes. Pacifiers. 1. Pacifiers are designed to be placed in the baby's mouth and sucked on for comfort. 1. They are typically made of silicone, latex, or rubber and have a nipple-like shape. 2. When using a pacifier, it is important to choose one that is the right size and shape for the baby's mouth. 2. The pacifier should fit comfortably in the baby's mouth and should not cause any irritation or discomfort. 3. It is also important to clean and sterilize pacifiers regularly to reduce the risk of infection and contamination. 3. Pacifiers can be sterilized by boiling them for at least 5 minutes or by using a microwave or electric sterilizer. 4. It is generally recommended to avoid dipping the pacifier in sweet substances, such as honey or sugar, as this can increase the risk of tooth decay. 5. If the baby is not interested in using a pacifier, or if they reject the pacifier after using it for a while, it is important to respect the baby's preference and not force them to use it. Thanks for watching.